Okay. Lovely to see everybody. I'll make a start and I'm going to do a quick introduction for Michael, who's speaking today on making research engaging. Michael Johansen's from Gateshead HDRC. So before we get started, a couple of quick housekeeping reminders to go through. The session is being recorded, so please do remember to keep your microphone off during the presentation. Closed captions can be accessed by clicking More on your Teams toolbar and then Language and Speech, then CC Live Captions. I'll pop that in the chat as well. Our presentation today is scheduled to run until 12, and we've got around 15 minutes dedicated to questions at the end of that time. If you're asking a question, and when we get to the Q&A, please pop your hand up or pop something in the chat. It would be lovely if you did put your camera on if you're actually putting a hand up, and nice to see you, but feel free to keep cameras off as we're recording. The slides from today will be emailed out after the presentation along with the recording and an evaluation form. We'd really appreciate you filling that in because it really helps us to collate feedback as we're developing the offer from the Specialist Centre. So a little about Michael. Michael didn't have a completely straightforward path into academia, and as he'll demonstrate through his presentation, he uses all of the skills that he's collected along the way and that he's developed through his career to ensure that he can engage with an audience so that they understand they've got a really important part to play and their contribution and positivity towards the work is a really crucial part of its success. Michael's been with Gateshead for coming up to 3 years, and during that time he's built really strong relationships with residents, council staff, councillors and public contributors, all of which he'll mention today in the context of how he gets the buy-in and also how he deals with the barriers that inevitably come up from time to time. So Michael, I'll let you take it away.
Excellent. Thank you for everyone joining today. It's nice to see that this type of topic is engaging for people. So Alex, if you want to go to the next slide for us, please. Let's double check. Can everyone see the next slide? Alex's is working for us.
Michael, sorry, everyone. Michael, it's you presenting.
Oh, right, that's even better. Sorry, that's good then. So thank you for everyone for taking part. Obviously, you're turning up today. What I'm going to chat about is how I've been able to make research engaging in my role. So I'm going to try and break down the chaos of my role as a researcher and try and give some sort of guidance on how I've ended up in this position, and then basically move from then into some case studies. So I do appreciate people want to see, I don't want it to come across like a book chapter to people who are on the call, but more of what have I done and how has it had that impact on people. So in terms of this, it's just like a maze. So as a researcher, I do get asked a lot, how do you do things the way you do it? Sometimes I have to do what everyone else does. I have to sit back and work out what is it that I'm doing. I just saw it as normal practice. It's just what I've become accustomed to. And then sitting back and having a look at this maze of engaging research and then trying to look at, well, what is it that makes it stand out? Why are people wanting to work on the research I'm doing? And it's been a nice challenge for myself as well to work out what it is and how are my experiences shaping the work that I do right now. Well, just to get straight off sort of in terms of the webinar, what I don't want it to be, it's not about research per se, it's not about different types of methodologies. I will cover different types of research, but it's not presented as a webinar of just the work, but the processes that go into it. So building on what Nicola introduced us before, my background is different. I don't see myself as a traditional academic. I taught for 15 years in further education, higher education, and that does shape some of the work that I do, the ideas, the approaches. Teaching children, young people and adults has had a massive impact on my role. So I'm hoping some of the stuff I share you can still benefit from, even if you haven't had the same professional background. So obviously teaching for 15 years in further education, so I was dealing with 16 years plus, taught all the way up to master's degree. The other thing that I worked in the VCSE industry as well as a mental health practitioner in secondary schools. So all of this has shaped how I approach research to be engaging. So the icon on the left is me being a teacher. I wasn't that teacher that just stood at the front and dictated to people, but it's how we engage the audience. In the middle, I'm a team leader in education as well. So again, my research isn't about just telling people what to do. It's like, how do we all achieve a common purpose? What can I get out of it? But what does everyone else get out of it? And my team leader role has helped us with that. And this little flat cap here, my background is quite diverse. So I do have a PhD in applied sport and exercise sciences. It was based on psychometric instrument design. But like I say, my interest in terms of research is around neurodiversity and complex health. So a lot of the transferable skills I did with drug use in performance enhancing drugs, the complications of that has made some types of research a lot more easier because of how I've had to do research prior. In terms of the webinar today, I am going to sell the oral health work as I go, because that's been some of the most enjoyable and engaging research I've been able to do. So obviously I don't want this to be a case of, well, I didn't have the same background as Michael. I've just picked up skills from different areas that I do use to the best of my ability to make things as engaging as possible for people. So just to try and start what is engaging research, there's definitely not going to be a checklist at the end where you just tick it off and every piece of work is going to be engaging. Engagement to different people will have different values. In terms of what I'm trying to approach it as, it's a bit like a trilogy of different books, books in the same trilogy. And the idea to have engaging research is to think about it at the very beginning. I can't stress, I appreciate that if you have a background in research, you will start with a research question or a hypothesis or however you work through it. I don't mean that. What I'm trying to get people to focus on is what is that you do at the very beginning that is going to get people to come on this journey. One of the things as a teacher that did teach me is that we do ask people to do extra work when it comes to research. It might be that if you do this, you don't have to do this part of your job because we're streamlining here. Research is not easy. Doesn't matter if you're a researcher and it comes natural to you. In my role in the HDRC, I'm trying to change culture. I'm trying to change capacity. I'm trying to make people look at different ways to do research. And if I was to approach research at the beginning and just acknowledge it's really easy, you're not going to have much engagement. As a teacher, every year it was always something else got added onto your role, and how much stress that puts someone under when you're interested children in teaching, and then you have all these extra layers. Research works the same way. So it's not a one-off thing. I would love to tell you that I could sell you in a bottle and every piece of work you do will be engaging. If you're HDRC or a LARP, you'll have lots of people engaging. People are sort of like running at you, asking to be involved, but that's just not the way research works. If you can get the beginning right, though, you will end up changing culture as you go. And I've got a really good example of how that happened. And I'll share how it has like a ripple effect on people. In terms of the middle, what we're looking at then is the relationships. So I can't stress this enough when I move through this. Don't refer to resources in your research projects. And if you have an engaging work, talk about people and what do people offer you and what do you offer people. This is really important for engaging research. The middle bit is you're going to spend time with other people who hopefully have similar interests. But the idea is that the professionals, the participants, these are the people that make this work happen. So I might have a really good idea as a researcher sitting in the HDRC. How do I get it to work? I thought about the beginning bit, which is, well, where do I need to go and who am I going to sit with? But the middle bit is who are the people I'm working with and what do they contribute to this work? In terms of the last book I've put on here, the end, is it? So traditionally what I've seen a lot when I've done work with communities is research ends and people move on, and I understand that does happen and there are lots of complications as to why that happens. But we can try and look at how we can change that. So I appreciate funding has a huge influence in your role on whether work can carry on and have this legacy, but not everything has to be another piece of work. And this is something else you have to consider. And I've got some information I'll share with you, and I'll show you how I've applied it. But it's also how does the impact of your work also add to engagement? Because if it does end, what happens next? Because if you had a really good piece of work and it ends and you didn't build engagement and you have a really good idea, those individuals that have already worked with you, are they really going to come on another journey with you, another year piece of work? So yes, it might sound very cliche, but I'm just trying to get people to think, and this is how I work. What's the beginning of me work? So I might have researcher on this side and what the beginning, middle, and end is, and on the other side is what the engagement is and how do I get people to become attracted to the work, enthusiastic, and want to take part. In terms of types of evidence, so this isn't about stipulating what is the best form of evidence. What I'm trying to propose here, when you want to make research engaging, sometimes you have to add or change people's perception of what research is. So let's just treat this like a list. And even the qualitative element is really generic because this evidence table is based on medicine, but it gives us an idea where to start. So you might get brought into a piece of work and someone's already got an idea of what the work will be or the type of evidence. Sometimes to have effective work is to try and take people on a different path, show them different ways to do research. I'm a mixed methodologist, so I like to try a lot of everything. We'll do qualitative, quantitative. But if you're working with people and they're doing the same thing repeatedly, we could argue that they do become stale. It's not interesting anymore. So for engaging research, try and look at something that they haven't done before. Have you got an alternative? And this isn't about talking down to people. It's just trying to look at a different way. So in my HDRC role, I've had some brilliant discussions where they might have an idea, might have something to do with statistics, but then there's something else we can do. We can look at the impact of the statistics rather than just describing. So in terms of engaging research, what I would stress, and from my own experiences, don't go just off what you're comfortable with, because you're trying to engage people to come on this journey with you. Try and get people involved in other areas. So we've had rapid reviews put together with staff. We've done qualitative pieces, ethnographies. Try and look at the type of evidence and how it helps us with our engagement. I know this is a challenge, so I don't want to be sitting here and telling people to change everything, because then you might sit there and go, but I've trained in this area. The way I would look at it is you're asking other people to feel slightly uncomfortable. So as a researcher, is there something else that you could try with the people around you that makes it engaging as well, rather than ask everyone to come on your journey? How do we shape it? So I work with locality teams, community health and wellbeing. I work with the family hubs. I've got different types of professionals who are working with us and trying to work to people's strengths as well. In terms of study, so in the HDRC, sometimes we get a lot of evaluations, but you might be able to shape how the evaluation is conducted. So, for example, I've had influence on changing the type of qualitative evidence and explaining it. And then hopefully by bringing people in, by just changing it, it's a bit like listening to the same lesson every day. After a while, you will not be engaged anymore. So we treat people's roles a bit similar, and they're doing lots of evidence collection. How can we just change it a little bit that makes it different? What I don't want people running out after this and saying, well, we've got to do a randomized control trial because it's the best type of evidence. It is in certain fields. Others, it might not be practical. This is just a table for you to have a look at and think of what could we do slightly different. Ask people what they already do a lot of. What could you do differently? Is there something to do with statistics that we could change? And rather, like I say, then describe it. Can we look at causality, causation? Can we do something different? Make it engaging for people. What else can they do? And I've got a really good example of this coming up where we've been able to upskill research to make it more engaging because of the people that are willing to support work. So in terms of engagement, I'll move away from the bit of evidence because I appreciate everyone's probably seen that quite a lot. In terms of engagement, if we just assume all these little dots are people, the thing that we just got to be aware of is engagement only needs to change one person in the room. The issue you're going to have is who is that person in the room, And this is about getting to know people. And one of the key things I would suggest with engagement is, as for my role, is where you sit and how much people can see you has a massive impact on how engaging research is for people. So in terms of engagement, we want to change culture. We only need one person, and this person in red could have a ripple effect on everyone else around them. How we do that is difficult, and I acknowledge that. So my first year of the HDRC was relationship building, doing a few projects, trying to engage with people. And then I found my area. And then once I was in the area I wanted to be, I started to just get to know people. So I took myself away from the traditional sense of a central hub. So for where I work, that would be the civic centre. And then I went and sat in family hubs, and I became part of their team. I'm not an embedded researcher, still HDRC research lead, but because people could see us, that ask us questions about my work, ask questions about their work. I might have an idea, I might see a funding call, and then I can go over to a play and activity coordinator and chat to them about that. But in terms of this engagement, you need to be seen, because when people see you, they can also see the hardships that you might go through for research, but also what I'll mention soon is how engaging you are in that space as well. So consider where you're based, how you gain trust from people. I've made some really close relationships in the HDRC, which has made me work engaging. And that was purely by just sitting next to people. So consider that in your own role. Think of where you're sitting, what teams you work with, how often do you get to be seen, how approachable are you? Is there a door in your office that is constantly shut? Because that's just door shut. It might be weighted, so it closes. But consider where you're sitting and how you're going to start this process. Once you nail this process, your work can be highly engaging, and it will lead to opportunities you probably didn't consider at the very beginning. So I thought what I'd start with is what it's not. So what is engagement? As an academic, and I chose this picture because me mentioning research, I don't expect everyone just to start clapping at us. I don't expect preferential treatment because I've got a doctorate. To be fair, I don't really use it at work. People just refer to us as Michael. It helps build that culture and connectiveness with people. But just because I've seen a good idea and I need people to buy into it, me presenting the work doesn't mean people are going to stand there and just start clapping for us. So let's acknowledge that research is hard work. We're going to do work with lots of different people, but my title isn't a prestige level. It is an achievement for myself and it lets us do work, but others won't buy into that same sort of notion that the warmth I get with my title lets us do work because of my skills. But consider this when you're talking to people. So what it definitely isn't is just us telling people there's research to happen, let it happen. We need people to be aware of why they do it. So I go back to when I used to start teaching 16-year-olds at the beginning of the year. They wouldn't clap when I walked in the room, but by the end of it, hopefully we've built this bond where we can still carry on this sort of learning. What I do want to acknowledge, though, is that there are issues of engagement. So some of the common ones are things like motivation of individuals, the clarity of their role. So what do they do full time? So for me in the council, it's what do they already do in the council and what would I like them to do extra for the research? It could be staffing levels in a team that you're not aware of. I do a lot of work with family hubs and I learned a lot about how they recruit, what the staff do, the amount of time that they have in front of children against other times of like admin, finance, resources. You don't know what the team's like that you're trying to get buy-in. And I'll be to discuss this like sort of on a personal level. Not everyone will be engaged in your research. And it's not about turning a whole team into wanting to be involved. So just to summarize, engagement is not just assuming people are going to come along, but please acknowledge that there are other things outside of your research. This had a massive impact on the oral health work I did. And I am a problem solver, so I'll go to meetings and I want to try and solve the problem before it happens, just so people can see that I'm not taking problems to them. So yes, just consider the person and their job, their life, their complications, in research and engagement isn't just turning up and just assume people will come on board. Research could collapse purely on the basis that people don't want to help. And that's their choice as well. So obviously when I chose this slide, I was probably giggling away to myself. I don't know why, just seeing a balloon with a face. This is one of the things I just wanted to talk more about. So engagement can be as simplistic as you sitting in a room and being contagious. From a public health stance, I understand contagious as a word isn't a positive word, but for someone like myself from psychology, this is something that we should consider more. So contagions is just about how we can spread certain things. So power of enthusiasm, the power of the happiness. For anyone that knows this, I normally have a huge grin on my face and it does hurt by the end of the day. But I'm just happy to be around other people and to do work. In terms of these three phrases, these are, in terms of emotional contagion, all I'm trying to get at here is if you approach your research and they see your face, people do copy and reflect what they see in you. So as an enthusiastic researcher, I do find it quite easy to encourage people to become part of my research. It's not coercion, completely different. But in terms of this, it's just more about someone else copying your behavior. So if you've had a bad day at work and you walk through the door, are you able to leave it at the door? And then think of how do you appear? So in terms of my work, being around people quite a lot, they get to see that it's not fake. I'm not tokenistic. I am happy because I'm doing work that has impact on people. So in terms of the emotional one, it just means that people copy how you are. So if you've got a really difficult discussion around research and you go in and you come across really negative, people are going to copy you as well. The behavioral element is that you can change people. So people can be happy being around you. This might sound really easy, but I appreciate it doesn't always work. But if you're around people for a long time, people then start to see this impact. So I've done research with family hubs, which have then led to funding calls, which have then led to other things after that. None of this would have happened if I wasn't enthusiastic, if I didn't go above and beyond to make sure our problems were solved in a timely manner. And then in terms of, so we've got, if you're happy, people see you being happy, they copy you. Then they start to change, which then means that their behavior changes around you. They want to be engaged, they become more curious. The social element is that you can then also start building culture and have more people engaged. But this isn't just practitioners. So in my role, I also consider how does this impact participants? So I'm not going to talk exclusively about PICE and co-production, but I need people to take part in my research. So if I can do this with professionals, I can also do this and consider the implications it has on participants. In terms of emotion, like I say, people will copy your face, people can see what you're doing, they'll change the demeanor, it'll have a huge spread on the team, but think of where you're sitting. I don't think I could do this sitting in a central hub around other like-minded or similar research positions, but not have any interaction with people. Once you're around people and this is happening, you can change. And there's a free effect mechanism that comes out of this. So let's say I am happy and I come in contact with someone who's doing me work, they become happy. Then they can pass it on to someone else, so they become happy. And then they pass it on to another person, they become happy. And then we have a final person, and that comes from one person. So it is contagious in a good way because we can spread the enthusiasm. This is really important when research gets challenging, because then you want to build this social space around people where they want to do more, they see the importance of it. Sometimes this is taken on top of their job. So you've got to consider that as well. Like how will they carry on doing this work in their own role as well? So if anything, remember the balloon, big smiley face. That is what you need to become, and just be in. This works for negative emotions as well, so just be very careful. But think of where you sit, how you act, how you're approachable, how enthusiastic you are around the work, but then also does this translate to participants of research as well? Then I was trying to work out in terms of, is there a way I could try and showcase before I go into the case studies exactly what it looks like. So this is just my experiences. So let's say my research is a tree. Trees take ages to grow up, but the hard work is embedding these values, and these were just some of the ones that I sort of privileged myself to demonstrate my relevance to their role. What does my research mean to them? As an academic, I love that publication. I love being able to speak at a conference and talk about the role that I've had and the work I've been doing, the people I work with. That doesn't necessarily translate to people themselves. Genuine involvement. Let's avoid the tokenism. You're not just there because you want to do research. You want to be there because you want to make change. The HDRC role for me and how it has impact on the residents of Gateshead. Authenticity. How does anyone even know you're going to achieve this unless you're around them? Trustworthiness. We'll talk about this in qualitative research. So we'll look at levels of trustworthiness. But as a person, how trustworthy are you? And I'm not like throwing shade at anyone's character, but if you want them to come on a year, 2 year project, can they trust you will achieve what you want to do and bring them along? Transparency. I do this with both my participants and practitioners. You can ask me any question, I'll give you an answer. It doesn't matter if I feel difficult giving you the answer. We need to make sure it's very clear what we can and can't do. And also embedding curiosity, going back to changing those types of research designs that people are selecting and bringing them on the journey of why. We then have engagement, so that could be also a PICE, co-production, working with other people. And then this is what it ends up leading to. So we've got all of these coming out of it. And rather than break down each word, I'm going to show you that in terms of my case studies. But all I would stress in terms of this element is that you don't always know what's going to come. And I've been quite surprised by my own work where other things have come out of it. So just some of the words: partnerships, new opportunities coming out of it, legacy, relationships, impact, and creativity that come with it. HDRCs are known for building research capacity, so the HDRC in Gateshead, and that's looking at the skills of those involved. So I sort of balance on these two sides of the coin for my work. I do want to build research capacity for engagement research, but I also want to build accessible research. Capacity probably sells itself, have more people being able to do it, ends up raising evidence-based practice, and we end up with better quality work with a research focus. Accessible research is how you can then also engage people to take part. So that might be accessible to the practitioner that you work with, but for my work, a lot of it is accessibility based around children and young people and parents in poverty. How do we get people to take part? And I feel like sometimes as a researcher, when I was studying, it was just, I'm going to do an interview. I need people to come along. That's not accessible. I've got to look at the whole picture and what can we do to make it easier. So what I've just said here, research isn't just a case of turning up. Engaging research also considers accessibility for participants. So at the top, I've got 2 red boxes. Basically, all I'm trying to state here is that my work for engagement for the participants, they aren't fussed about publications and conference. If I sit down with them and say, please take part in this because of publications and conferences, they're not engaging in my work. That shows I'm detached from the participants. Am I happy to have publications and conferences? Definitely. I enjoy the accolades that come with it. I am a researcher. It gives validation to the quality of the work that I'm doing, but I don't start on that journey to achieve both of those. I'm looking at the ones at the bottom. So these are just different ways that you can look now at how you engage your participants and what kind of evidence do you give the people that take part. So I've listed some additional ones. So we've got social media, storytelling, infographics. Some of these I've been able to have the fortunate position to get some of these out of the work. So yeah, 1 and 2 might be academic validation, but for engaging research, please consider different ways. Flipbooks is a great way to communicate with, say, children and families. They don't want a PDF. There's alternative ways to go about it. So this isn't me dismissing publications and conferences and saying that doing that's not engaging. It's engaging for a different audience. For my work, my populations, the people I work with, they will engage more with number 3 to 13, and I'll explain some of them as we go. So just for the last part of this, I just want to try and show you some of the case studies that I've been working on that to me are engaging, to then allow people to see what else has been happening in terms of what engaging research is like from my perspective. But obviously it doesn't give you a list that you can just follow, but hopefully you'll take some learning points from this. So in terms of the warm welcome spaces, we got invited into a meeting, and I sat with the service director for community health and wellbeing, and they just wanted to know, this is at the time very new, what kind of evidence can we get out of it? So I was quite fortunate at the beginning to be able to shape the methodology, to choose the engaging approach, and then apply it, and then bring people into that approach. I didn't have to change any type of methodology. This wasn't funded, this piece of work. I did ask for reimbursement for participants as part of it, which the community health and wellbeing team were really supportive of. But I was able to explain, to make research engaging for participants, why this was really important for them. So I'll talk about case study 1, and then I'll show you a funded piece of work. So this is how the research pretty much ended up looking like. So we end up with a phase 1 and a phase 2, and it's been 2 years of work. I'm working on this with a colleague, Dr. Kate Haddow. So she's the research lead for poverty. When we started this project, there was no evidence. There was nothing in place. We just had to work. So I spent a lot of the beginning in sitting around the team that I needed to work with. So that was the community health and wellbeing team. Their team has grown since we started this work, obviously not because of this work, but it meant we were able to sit around more people. In phase 1, we started with focus groups. And the reason we had to go down the qualitative is because we had no prior evidence. We needed to work out why warm welcomes were happening, why were these spaces existing in Gateshead. We did 5 focus groups and published the work. Everything's done for that one. There was engagement, but phase 2 is the bit that made us more excited, because we went from 1 team in phase 1 to 3 teams in phase 2. So now we're working with learning and development, working with community health and wellbeing, and I'm working with the locality team. My enthusiasm working around the locality team, sitting with them for the past 2.5 years, has allowed this piece of work to happen. So we've had some significant engagement in this process. So phase 1 started with 5 focus groups at 5 different warm welcome spaces in Gateshead. Phase 2 has the potential to reach out to 88 warm space sites in Gateshead in the next 4 months. If the research was engaging, there was no way that would ever have such an exponential jump, jumping from 5 focus groups to 88 different sites taking part in a piece of research, and how much of an engagement we've had as part of it. Here's a picture. I do apologize for my very meerkat-ish approach. In terms of stage 2, when we started working with the locality team, so in this picture here on the right, made really close connections with, we've got Mick and Craig. So Mick is a locality connector and Craig is a locality coordinator. So we had this grand plan of upskilling a piece of research, but we couldn't do it alone. We've now went from us collecting the data to the local authority staff from the locality team and from the community health and wellbeing team collecting this data with guidance. They've had input into workshops for design, to an element of co-production. There will be times that even my enthusiasm and happiness can still have questions around research. So as my background being psychology, I wanted the questionnaire that we have to include an element where we could sort of test the truthfulness of data collection, which did cause some sort of discussions because people weren't familiar with that type of research. But the transparency in it wasn't to hide from it. We called an extra workshop, and as part of the engagement, I just stood there, presented on it, placed my argument, they did theirs, and then we looked at how there was compromise. And by being able to do that in this engaging piece of work, we ended up with the outcome to the piece of work being able to move ahead to the stage where in the next week we're going to have locality connectors going out all across Gateshead to start data collection. To me, that was a massive element of engaging research because they don't have to do this piece of work. We've also embedded into their role, so where they are already going and how they can do this without doing too much extra work. It is still extra work because if the visitor won't welcome site, they are going to have to collect data. At the same time, it's how we do it in a way that it's also meaningful for them. And then I just thought if I stuck the 13 in that I mentioned earlier on, these are what we got out of it. So we are getting publications out of it, but that isn't the purpose of why we had those people around the table. It has went out on social media. We did present it at the public health conference, but it's had policy impact on this one. It's changed the way funding internally is being used, and we were using storytelling as part of the output. So that was sort of one example of engagement. The one that fills us with the most warmth is this piece of work. So I've been doing a lot of oral health research with neurodiverse children. The neurodiverse children we're working with are in mainstream education. This is a funded piece of work, so I do want to acknowledge that some of the stuff I have been able to do is purely because of the funding. And I don't want to sort of lead people down that route of, well, I'll do this as well, but how do I do it? So we got funding from the Children Health and Wellbeing Network from North East and North Cumbria. Without their input, this work wouldn't have happened to the same level. So I'm working with neurodiverse children. The reason I'm using mainstream education is because of my teacher role, I used to have to deal with a lot of complications that children might have. But if you can put things in place, so if we can make a neurotypical world accommodating for neurodiverse, not everything has to be a referral for a child. And I've dealt with enough children to realize by tweaking a little piece of the way we work means that they just function in this world by us being more accessible. So that's why I focused on mainstream education. In children who are originally, it was for children who were referred, who were diagnosed as what was referred to as ESD, so autism. We then opened it up to those children that were also referred. So one of the things that we looked at for accommodation for research was also too many times parents seem to be, there's like a battle with parents, which is you haven't been diagnosed yet, so you don't have it. But we know that children who are being referred, there's still a good chance they do have it. So we opened up the opportunity to have more children take part. And we're working with this accessibility element with parents. And then these are just two parts of the project, but this is just to give you an idea. We were doing one piece of work that was looking at creative art workshops, and then we were doing interviews of parents. What I wanted to just sort of go through for the last 5 minutes is how we did it. So these are all of the different areas that we made and implemented. So we looked at the engagement with parents and our involvement with PICE and the Gateshead Parent Carer Forum and how influential they were in changing our plans based on what was already there, what would be more beneficial to parents. This work was accessible for families. It might not be very clear on the side. We got permission from the children to take part. So the children were 6 to 9. So we had consent from parents and we had assent from children. And yes, it might not be that they then signed themselves off to take part in the research, but this was all about accessibility for children to feel part of research. Obviously, we've had a lot of the research shaped by the Family Hub practitioners, and we've had adaptive PICE as part of it. But what I want to show you is just exactly how it looks. So when we did the work with the children, research was hidden inside play. It was hidden inside play that was relevant to the research topic, and it was done by practitioners. So by being a researcher, it wasn't a case of, I know everything, you do as I say. We brought in as many people that would make this as realistic as possible and as accessible. For accessibility, we made sure the sessions ran in different areas of the region, so there was more opportunities for parents to take part. All the children got paid for taking part in this research. They were reimbursed for their involvement. They produced over 60 images as part of the research. So I do apologize that you aren't getting a clearer picture of what the research was about. It was to design communication cards that will be used in private dental practices in Gateshead. And it's to engage adults to talk to neurodiverse children that use general dental practices. So we end up with lots of artwork. And this is one of the areas of engagement we were really proud of. So we were fortunate enough to go to the community room at the Metro Centre. We ran a huge event where we were able to showcase the work. I had my SPHR intern, Anna, who was absolutely brilliant. Her whole focus when she was working with me was about accessibility, engaging with parents. It wasn't writing literature reviews, doing studies. It was more about just be around the right people so you can see how engagement looks. So I had this work with children happening. Also, I had a letter sent to us, so we did some inter-researcher reliability for selecting artwork with a local nursery, so the Grove Preschool. They took part in this and they were reimbursed for the time. And then I got this sent to us by the children to say thank you, and this was all part of accessibility work. We were then able to showcase the children's work. So we went out as part of the community activity, and Anna, the SPHR intern for us, set all of this up. And it got lots of interest. There's opportunities for the work to be showcased. So this work has been translated into a resource. But this is about accessibility, getting more children to see what we're doing. So they want to take part in the next piece of work. They want to become the next researchers. They want to just ask questions about it. So I had all the children's work on show. We've had engagement with nurseries. We've had opportunities to do flip books soon where we're going to demonstrate this artwork in different ways. But in terms of the focus, so coming to the end, the reason it was engaging because I looked at what the parents had to go through for this to happen. So in the summer, as one of these other parts of the works, we did this. Then we did a summer separate project. I had 19 parents take part in a summer holiday. And they came to do interviews on their oral health experiences, but we put workshops on for children to take part. We'll give respite to parents. We'll look at how far they have to travel. So I mapped locations in shape software just to work out how long does a bus take to get to this location. Think about what it's like to get that person to the location. The family hubs had a huge influence on this as well. So we had meetings about how do we get the parents to come. So yes, it's all good and well having a workshop where children get stuff for free and get to take part in research. There's still other barriers you have to consider. But through the oral health work, we've been able to showcase the amount of children that have took part, the parents that are able to give us their views and experiences. We produced, so on here, so we will have publications and conferences. It went out on social media. Infographics were used to share the PICE work we did. So parents were able to see those who took part. Our PICE sessions took part at the Metro Centre as well because it was openly more engaging and it fitted in with the PICE group. So I was invited along. Again, none of this would happen if I wasn't enthusiastic and I wasn't around and I wasn't approachable. And these were some of the key things we looked at. Obviously, Anna will be looking at doing a blog. We've had events. We've had the Metro Centre events. We've got flip books that are coming. And there's even more that's going to come out of it, but it's considering what work looks like and how you can get people there as well. So I thought, can I summarize everything I've just said to you in 3 points? It was quite difficult, but let's just acknowledge it's not a logical process. It's not a straight line. And you get to the end and you've got engaging work. My oral health work is more like a scribble. I started at one point, and the more contacts I made, the more engaging the work became. But none of the subsequent work would have happened if the original work wasn't engaging enough. Always think far ahead because you don't know what other things might happen, but please don't get distracted by your own academic priorities. I'm not dismissing them. They are important, but that isn't what's going to get, for me, children to come to a family hub, a parent that might be experiencing fuel poverty take part in a project. How are they going to come along and feel engaged? And then I just thought, this is me, be bold, be grand. I've been told so many times to rein it in. Don't rein it in. Just make it as grand as possible. Sometimes you will fail, but people can come on that journey and experience it with you. And being engaging, you might realize more people will help you. So that grand plan becomes more accessible the more people you have around you. And this is anyone who does actually know me, power enthusiasm, the amount of things you can get done by just being enthusiastic about your work. I know that might not be taught on your academic studies, but being enthusiastic does open a lot of doors. But that's the end. So I guess it's over to questions now, Nicola. So if anyone, I know that was like a really, I've sped through that really quickly. But if anyone's got any questions, more than happy to answer them.
Great, thank you, Michael. Might take a minute or two for people to digest and do a bit of thinking.
I'm just glad you didn't tell us that I was on mute for the last hour.
No technicalities. All good. All good.
So yeah, if you just want to stick a question in or ask, I'm more than happy to. I'm more than happy to answer anything you've got.
Do you want to stop sharing your slides, Michael, as well, and then we'll be able to see if any hands are being popped up.
Right, there you go. I found it. Button moved.
Catherine, would you like to ask your question?
So it's a very broad one, but so I'm a GP working in homeless health in Brighton and doing work around alcohol-related liver disease. So I'm always a bit wary about social media. I know that sounds like a very broad statement, but I'm just concerned about how potentially polarizing it is, and the difficulty in terms of managing the response to it and how the message could potentially be affected. And I'd just be very grateful for any useful guidance around engaging with social media, because I know it's a very powerful platform, but potentially one where it's difficult to manage where the conversation goes afterwards.
I know it's a different sort of topic area that you mentioned there, Catherine. So a lot of the time we use social media was sort of to raise awareness of what we've done. But I know what you mean, like the discourse between you chatting to someone about the issue. So all of our work obviously had to go through ethics. So we considered that, but not for social media in terms of like if parents made disclosures, like what would happen from it or where would we refer them. So I guess it just comes down to what you're using the social media for. So for us, it was to raise awareness, but not necessarily to engage as part of the research, if that makes sense. When it did go through social media, it went through the teams. So it wasn't me releasing it. It was through family hubs, our community, our comms team. So they catered to that. So I'm not too sure how you would deal with anything if someone asks something really complex or difficult. And I appreciate you open up that platform, don't you, where there's lots of people and then other people might discuss it as well, and it might not be the correct advice. So I guess it's just more about looking at the referral pathways. So if anyone does raise some issue, like a query, we're already preempting where the support is. We did it with children with neurodiversity. So we had to express that taking part wasn't part of a diagnosis. So we didn't want to set parents up where they thought, because I'm there, they'll be asking me a question about speeding up an education healthcare plan. So we were very clear what the purpose was of whatever the use of social media was. So I guess it's just setting expectations. I know I've sort of skirted around your question, so I do apologize. But yeah, I think it's just looking at how you preempt what questions you might get asked and how you can help people.
There's some really clear practical tips there, so thank you.
Yeah, no problem.
There's a comment come in the chat as well from Danielle. She's also an oral health lead, or she's working in oral health on West Sussex, and asking if you'd be happy to share any published papers or research findings, because I guess it'll take a little while before the paper actually gets to that point.
So Danielle, I am putting together something for Nicola that's going on it was the case study, isn't it, Nicola? So I do, technically I owe Nicola it. So I've just dropped myself in it there. So there will be some little small impact things that way, but more than happy, like me emails on the chat, Danielle. So if you ever want to drop us an email, manuscripts will be getting done, but there's still so much work. I keep getting distracted by the opportunities that keep arising. So I can write the paper, but then it's led to another project around supervised school toothbrushing as well. So like the papers keep getting put on hold while I get to do more engaging work. And then I think I'm going to end up sitting down for a couple of weeks and then write the papers. But yeah, be great to share. And I think there might be some opportunities where I would love to showcase the actual study properly, so you can see where what the resources look like, where they're going to go. That's something that I know Leslie's on the chat, so I'll probably try and speak to Leslie to see if there's an opportunity to present that piece of work as the work rather than engage in research. It'd be great if you jump onto something like that. So yeah, you should put. So yes, it would be nice to talk about the research more specific, because the output we've had. I'm allowed to quickly tell them, Nicola. So it's going to end up being 40 decks of 40 cards that we're going to be looking at once we've got ethical permission to put them into general dental practices. But again, the next part for me is, how do I have dental managers engaged in research for me as well? And how does this help children? But the resources are going to be made and they're going to be in the children's hands. So hopefully, I'm hoping that we'll end up with more children having more positive experiences with oral health. But happy to chat. Anyone else?
That's great, thank you.
Catherine, would you like to ask your question?
Hi, that's all. It's absolutely really interesting to hear that, and it's so refreshing, because so much research, it just ends up in a publication and then that's it and nothing ever happens, and it drives me up the wall, quite frankly. I was just wondering, how do you deal with kind of like getting funding for these things? Because obviously things like infographics, flip books, things like that have quite a cost attached to them. And a lot of researchers don't necessarily factor that in with their funding. So I just wondered how you'd kind of manage that.
So at the time when I applied for the funding for the Child Health and Wellbeing Group, it was more about, this is a piece of work I'd love to do. And then when I got granted the money, I was like, how do I use this money as best as I can? I've stretched every pound and penny as I can, because this small piece of work, and if anyone's on the call who doesn't have that much experience of funding, look at even the small funding grants can open up the doors. But also consider, if you get funding and your research isn't engaging, and then you have to ask for more partners to come on a bigger project, it's going to be really difficult. So for me, a lot of it's been learning on the job, Catherine, but we have a really good comms team. So I'll say to them, here's my idea, and this is what I've got funding for. Can you make it happen? Sometimes they come back, and because of the connections that they have with being a council, they can go, we can do it for this price. If you were independent, I would envisage it's probably a lot more difficult. But because I've been able to make those connections with people outside the research team to help research, so Rebecca should not mind us mentioning her name in the council, has been absolutely phenomenal, because she's helped us design. I'll mention something and she'll say I'll have it made. So we've done front covers for all the professional documents for the PICE groups. She's supporting the flip book design. I'll ask for an infographic, so rather than me try to build it, I just suggest what we would like and they go away and do it. But I appreciate not everyone has that. So if I didn't have that, I would probably have to look more further ahead to see how much it would cost at different printers and then factor that in. I'm playing it a bit wild, I've got to admit, where I've got people around us who can help us. So if you don't have that network around you, think about how we can build it, or I would look at costs early on so you can factor them in. But yeah, I do agree, it's not cheap. I don't want to tell you how much I did the research for, but I managed to stretch it really far, and it's been really impactful. So yeah, hopefully I'll get to showcase the work, but hopefully that answers it for you, Catherine.
Brilliant. That's great. Thanks ever so much.
There's two more questions come in on the chat, Michael. I think that so fairly brief answers on both of them if possible. Emily, I'll just summarise her her points. So she's a PGR student, mainly disseminated work through papers and conferences. But given what she's heard you say today, what are good starting points for being able to be a bit more creative or accessible when it comes to disseminating your work?
So for me, Emily, I've looked at the audience. So I've tried to look at what they use. So as a teacher, I do like to mess around and try and build stuff. So flipbooks for us is the next direction. And the reason we're going down the route of flipbooks is because of how, as a parent, the amount of PDFs that get sent to us, and they're not engaging. So I'm using my own experiences, but then thinking what would children like? But we're embedding that into the PICE as well. So if you can make links, Emily, with PICE group, like a VCSE that is relevant to your work, I would use them as starting points of your discussions of, yeah, I want papers and I want conferences, but what do you want out of it? I think that would be a good starting point. If not, take some of the pointers off the slides and have a look, like, is it a blog? How effective are they? And I know they're not all easy to engage with, so I'm not underselling, like saying one's better than the other, but for me, I've chose what I think is going to have the most impact. So I went with flipbooks, you might go animations. But yeah, start speaking to your VCSE groups and see if they've got some ideas that can help you with, Emily.
Mark has asked if you want to share the blog that you mentioned with views, so we'll make sure that you're all in contact with one another. And then final question from Macon was around using the NIHR Participant and Research Experience Survey. Did you use that to gather feedback or to gain insights, or as an alternative, what did you do?
No, I've never seen that before. So in terms of what we did, we were gathering the feedback through the PICE groups. So when they were shaping the documentation, we used creative methods to gather the feedback. So I've done like a radar diagram that's based on their perceptions of how good something is and where changes have to be used. But I'll definitely have a look at it. In terms of the children, we just didn't want to overload them because I'm dealing with 6 to 9 year olds. And if you give a gift card to a child at the end of the session and you haven't already handed out the questionnaire, you're probably not getting them to give you any more information. So yeah, I'll definitely have a look at it though.
Great, that's excellent. Well, I think that brings everything to a close. We're right on time at 12 o'clock. So just thank you so much, Michael, for that excellent, relatable, accessible presentation. And you're right, you know, smile goes a really long way, doesn't it? And you've got to show that resilience sometimes because it doesn't always go your way 100% of the time. But you keep plowing on and you keep the positivity and the enthusiasm. And you're on the front foot with that. So really inspiring to hear about it.
No, thank you for the opportunity, Nicola.
Thank you. Well, thank you so much for everybody. Just a quick reminder about the feedback form that will be sent out as well. It's really helpful if you can fill those in. And also it'll be really nice for Michael to see that feedback and the positive comments and things like that as well. So thank you so much.